Okay. Hi, my name is Megan Adkins, and this is my persuasive speech. When you want to cure a disease, you don't just attack the symptoms. You want to get to the root of the problem and work from there. In the state of Texas, on average, there are 37.8 unplanned teenage pregnancies per 1,000 teenage girls. That puts us at number 46, near the bottom of the 50 states. We also rank number 11 in the CDC's ranking of STI infection rates. And coincidentally, we also happen to be one of the states leading the charge against Planned Parenthood. Planned Parenthood is a clinic devoted to the reproductive health of both men and women, and it needs to stop being the controversial subject that it is. As an American woman, I support their efforts to provide reproductive health at all levels. Its mission statement, when it was founded by Margaret Sanger at the turn of the century, is to provide affordable health care and preventative medicine to lower-income women who would otherwise not have access to life-saving cancer screenings, and they are also on the front line in the fight against STIs. And with their contraceptive care, they lead to an actual reduction in abortion cases. At its core, Planned Parenthood prevents pregnancy. The Guttmacher Institute says that 70% of women in their childbearing years, that's ages 15 to 49, or 43 million to put that into perspective, are sexually active and do not wish to become pregnant. 31% of Planned Parenthood services offered are non-abortive contraceptive cases, and this is provided to more than 1 million clients every single year. 197,000 women come in each year for an emergency contraceptive service known as Plan B. Having children makes it far less likely that a teenager will finish high school or obtain a 4-year degree. In 1969, President Nixon said, "Unwanted or untimely childbearing is one of several forces which are driving many families into poverty or keeping them in that condition." And President Nixon was one of the frontrunners on the war against poverty. On average, a kid is going to cost $250,000, not including college tuition, of which we are all aware is very expensive. And women are sacrificing possibly higher paying jobs because they are being forced into motherhood through lack of accessible care. As the largest provider of contraceptive to lower income and urban area women, Planned Parenthood ensures that women can choose how and when they decide to become a mother. And at the end of the day, Planned Parenthood reduces the number of abortion cases in the United States every single year. 12% of their services are abortion related. However, that is eclipsed by other services such as cancer screenings and prenatal care itself. 61% of women who receive an abortion already have a child at home that they know they can't take care of. And states with defunded Planned Parenthood have the highest rates of unplanned pregnancy, such as Texas itself. Texas, Oklahoma, and Mississippi all lead the country in that area. Defunding these services increase the number of unplanned pregnancies, and at the end of the day, if a woman is going to receive an abortion, she will find a way, whether it be in a back alley or in unsafe practices at home. In fact, in the state of Texas alone, 240,000 women have reported attempting an at-home abortion and needing clinical care afterwards. Planned Parenthood is a lot more than an abortion service and seeks to empower women through reproductive choice. By the continued operation of these services, we can help women more fully participate in the economy and reduce poverty rates. Regardless of your feelings about abortion, Planned Parenthood gives power to women to decide how, when, and if they want to start a family.